Hello and welcome to this week's episode of Dada's Show, coming to you from Emara Ole Sereni here in Nairobi. I'm your host, Ashiko Mbune. Now, the Dada's Show aspires to promote a spirit of sisterhood and solidarity amongst Kenyan women. And we do this by creating a safe and open platform for them to discuss issues pertaining to their lifestyle, their health, their careers, their families, and anything that affects them in one way or another. Now, women experience hormonal changes throughout their lives, from menstruation, from puberty to menstruation, to pregnancy, to menopause. Now, what you did not know is that throughout all these stages, the hormones affect the oral health care, which leaves women with, special oral health care needs. Now, you may be wondering, what am I actually talking about? For instance, when a woman or when a young girl is menstruating, the hormones that are responsible for her maturity, which is estrogen and progesterone, can affect her gums, or can affect how her gums behave around germs. For instance, she can get pain and she can be affected in one way or another based on these particular hormones. Menopause as well. Menopause can also create certain oral health care issues for women. For instance, they can have dry mouth, they can have, different, tastelessness, and a myriad of other issues. Now, because women who are watching me right now and some in my audience, at some point or another have experienced hormonal changes, are about to experience hormonal changes, or are anticipating hormonal changes, we felt it important for us to actually meet with dental practitioners to actually shine some light on some of the unique needs of us sisters, of us ladies, when it comes to oral health care. So today I am joined by lovely ladies who have made it their life mission to, first of all, give us a lovely smile. So they have learned the art of smiling, and also to teach us more on oral health care, not only for women, but for the general public. As always, we look forward to hearing from you. So reach out to me on all our social media platforms at Ashiko the host and at KBC Channel 1. Give us your feedback, give us your responses, ask questions on this and any conversation we may have had before. So before we jump into this very educative episode, let's take a look at the following feature.
Good oral health is absolutely vital for our overall health and well-being. Without sufficient oral hygiene, the bacteria in our mouths can reach levels that may lead to oral infections such as tooth decay and gum diseases. Dr. Maran shares some of Kenyan's bad habits when it comes to their oral health.
I'm also the co-founder of Smile at Dental Clinic, which is located in Parklands. When we are talking about Kenyan bad habits, when it comes to their oral health, number one, they don't brush their teeth consistently, leave alone once a day, but you're talking about twice a day. They do not floss. Some of my clients do not know what floss is, so we have to demonstrate what flossing is, what it is, where do you find it, and how do you use it. Number three, lifestyle habits. We all know Kenyans can drink quite a bit of alcohol, and that is a drying agent in itself. We should brush our teeth twice a day for 2 minutes at a time. When you're brushing your teeth, please buy a toothbrush that has a small head like this, especially if you have a gag reflex. Number two, make sure the bristles are nice and soft. From there, we're going to take our toothpaste and we're going to use a pea-sized amount. This is what a pea-sized amount should look like. So the most important thing is to make sure you're brushing your teeth, and please touch on the gums just a bit. So you're supposed to angulate your toothbrush into a 45-degree angle and in circular motions like that. So people have different methods and different starting points. What is of importance is that you maintain the 45-degree angle. When you're coming to the chewing surface, kindly clean back to forth. You can also maintain the circular. When you get into the side where your tongue rests, this is where your tongue normally rests, 45 degrees again, and you do it in a circular motion. The next part to clean is the tongue. So you clean out your tongue going outwards. Just scrape gently going outwards, right? As you're brushing your teeth, kindly remember to floss. In fact, have the floss somewhere on the table so that you're able to access it immediately you're done with your brushing.
Only a small proportion of Kenyans seek dental treatment, the majority doing so only when there is pain or discomfort.
Kenyans should visit the dentist twice a year. Your dentist will inform you of your oral health habits in case you're not brushing properly, if there are areas you need to tighten up when it comes to brushing, if you need to floss more, if you need to use a mouthwash, and in case of any problematic areas, your dentist will also give you a treatment plan and how to go about it in future.
There are restorative treatments that help to rectify the problems caused by poor oral health in order to improve the look and the health of the teeth.
Whitening is not necessary, but if you'd like to have it, then I'd say go ahead, so long as your foundation is right. We have to do a screening to make sure you don't have cavities. This requires us to do some x-rays for you so that we can check in between your teeth. You see those areas I keep telling you to floss? Now those areas need to be checked for cavities. Once those are cleared, the alignment is fine and everything is clean, then we can go ahead and comfortably say we can whiten your teeth. Of course, the most important thing to check out for when we're doing whitening is whether you have sensitivity or not, because that will advise us on what kind of chemical per se to use and the intensity of it. Some of the best practices when it comes to taking care of your teeth and your gums is maintaining a good diet, eating natural foods. Number 3, we're talking about drinking water.
The Dentist Association of Kenya earlier claimed Kenya has one dentist serving more than 70,000 patients against a recommendation by the World Health Organization of one dentist per 7,000 patients.
The challenges I faced as a female dentist, number 1 and most importantly, is credibility. Sometimes when you're talking to our clients and you present a treatment plan, they're a bit apprehensive about it and they don't really trust what you're saying. If you were to give the same treatment plan via a male dentist, then the client is more willing, more receptive, especially in our society. One other challenge that we face is harassment. Sometimes you have clients who are very aggressive towards you. Sometimes they're very unprofessional because you're in a professional setting, and some clients may not be able to respect that. So we've come around to figuring it out with time, that when your client is there, you make sure other people are with you in the room, whether female dentists or male assistants or hiring security. CCTV also helps us a lot in that aspect.
Our teeth are also necessary to give our face structure and to help express our emotions. Oral health is therefore absolutely key when it comes to our confidence and self-esteem. For Dada's show, my name is Miriam Sava.
Welcome to Dada's show. As mentioned, the conversation of the day is female oral health care. And like we mentioned before the break, due to the hormonal changes that take place during a woman's life, this actually affects her oral health care. And you know, some of us never knew this before, when you're menstruating or when a young girl is going through puberty or when you're pregnant, that this actually has an effect on your oral health care, be it from your gums to your teeth. And that is the reason why we have brought here this wonderful panel who are actually dental practitioners who will give us, educate us more on today's topic of the day. So right next to me, I have Dr. Salome Kenyita. She is a dental practitioner. She'll tell us more about herself and how she got into this line of work. And then next to her, we have Dr. Marion Ngumo, who is also a dentist. So I'm very happy because I have, a sisterhood, all girl. So of course, these ladies not only have the industry knowledge, they have first-hand experience on what we are talking about as being women. Of course, I cannot fail to acknowledge my wonderful audience who take time to come and sit here with me week in, week out, as we discuss contentious issues, as we encourage each other, as we uplift each other. I will definitely, acknowledge you, and we will be touching base a little later on in the show. So to start us off, I'll start off with you, Dr. Salome. Tell us a little bit about yourself and how you ended up in this particular line of work.
Thank you, Ashiko, for hosting me. So my name is Dr. Salome Kenyita. I'm a dental surgeon and a public health specialist. My dream of becoming a dentist and a public health specialist started when I was 15, when I had a toothache, and my dad took me to a dentist in town, and instead of removing the tooth, they performed a procedure which I would later come to learn. It's called a root canal treatment when I joined dental school. Fast forward, I definitely worked hard towards attaining a grade that would see me being admitted the dental school. And after graduating as a dentist, I was posted in a mashinani, and so I was shocked, but how unaware people are about one, just the oral health and all the options that they have other than having their teeth removed. And so now that now also ignited that bit of public health, since if my dad was not aware that there's a dentist who can save my child's tooth, probably I'll be having very few teeth in my mouth. And so I was like, these people are here because these people are removing their teeth because they do not have that knowledge.
Yes.
And so as a dentist, so I made it my purpose or mission to go back to school, study public health, though it does not really deal with only dental issues, but it's about educating the public.
Yes.
So that now I can be well equipped to educate the masses on the oral health, importance of it, and the options these people have apart from having their teeth removed. Yes.
Thank you so much, Daktari. You know, and I'm so glad about your journey. And you know, we were discussing how much sometimes our childhood experiences influence the decisions that we later make and how it carves our life. So let me move on to you, Dr. Marion. Thank you so much for making time off your very busy schedule to come and sit with us. So I'll pose the same question to you. What made you choose to become, you know, tell us a little bit about yourself first, and then tell us why you chose to become a dentist.
All right, thank you, Ashiko. My name is Dr. Marion Ngumo, and I'm the co-founder of Smile at Dental Clinic in Parklands. And I have been walking this journey of dentistry for 13 good years, and I've never looked back. So I was inspired to be a dentist after Form 4 when I was attending a leavers course at Strathmore University. And a friend of mine and I were standing at the bus stage waiting for a matatu to come and take us home.
Yeah.
So as we stood there, an older gentleman drove by in a really nice car. He looked at us and then he decided, let me turn back and say hello to these girls. So when he turned back, I was looking at my friend and telling her, look what you've done. And the man smiled at us and then he said hello. So the package was right. But the teeth, there was just something not quite right about his teeth. Obviously, we were so young, and in hindsight, he was not older. He was probably in his 30s, as I am now. So my friend and I had this discussion, and we were like, perhaps we should consider dentistry because we were not settled with our choices in high school. And for sure, Dr. K and I ended up being dentists, and we've been happy ever since.
Oh, wow. Thank you so much. You know, we need to find that gentleman and perhaps thank him.
Oh, yes.
You know, and I hope he actually got help. And, you know, it's interesting that you point it out like that because I wonder how many people actually pay attention to oral health care, you know, and how many people consider teeth as part of the body, you know. So I have a question for you, Dr. Salome. So since we were being brought up, you know, since Enzizile, we've always been taught about oral health care. Silvio, we've always been taught about brushing your teeth twice a day, flossing, avoiding sweet, sugary things, etc. And so for all intents and purposes, people understand, people know about oral health care, but do people really understand the importance of good oral health care? And kindly share with us some of the results of poor oral hygiene.
Okay, so thank you. So though many people practice what they know or what they learn, when it comes to oral health or dental health, most people, yes, they know they should be taking care of their oral health, but they do not do so, simply because I think a majority of the people do not really see teeth as part and parcel of the human body.
Yes.
And so there's that laxity in taking care of the teeth. And also they brush their teeth. And even for me, before I joined dental school, I didn't know there's a right way to brush my teeth. Yes, so it's not just brushing your teeth, there's a right way to brush your teeth. So that and not practicing the proper oral hygiene leads to now people developing many problems. Majority of these people do not know the implication of poor oral health into their general health. The theme of this year, World Oral Health Day, was happy mouth, happy body, and the importance of oral health in the general health.
Yes.
Why I support that, there are just a few, just to name a few. And the very first one is there's something we call oral health related quality of life. Giving two examples, the first one is if you have bad breath, for example, which comes as a result of not taking care of your mouth, just maybe simply brushing, your oral health quality of life, your quality of life is interfered with.
Of course.
I'll not be comfortable sitting next to you.
Of course.
I'll not be comfortable talking to people, and so I'll have that low self-esteem. The second one is pain. If you have pain due to neglected oral hygiene, your quality of life is affected. You'll miss school if you're a child. You'll miss work. And you'll also miss family time because you are in pain.
You're in pain,
You're in pain. And those are just the minor complications. Now we have major complications of neglected dental hygiene. One, this small cavity that is causing you pain, if you do not seek timely dental treatment, it can progress to something that is life-threatening and can actually lead to death, something we call Ludwig's angina, something that spreads either to your brain or to your chest.
From that small cavity.
From that small, tiny hole that would have been
teeth, that you've been ignoring.
That you've been ignoring, that would have been sorted within 30 minutes of you visiting a dentist, now can turn into a life-threatening condition. That can actually, it will lead you to being hospitalized. And if you're lucky that you get to hospital in time, your life will be saved. But it will be saved with some form of disfigurement, because now that swelling sometimes leads to you losing part of your jaw. Another one is there are these conditions. They are very, very common. Diabetes, hypertension, rheumatoid arthritis, all these have a relationship with oral health.
And I'm sure so many people don't know that.
Yes.
I think I only recently found out that there's a correlation between, arthritis and oral health.
Yes.
Okay.
Yeah. So, for example, something like diabetes, it's a two-way. Oral health can make diabetes worse. So you might be taking your medication, you might be going to your doctor, but maybe your sugars are still not being controlled. Have you visited your dentist? Is your oral health okay? There's a disease we call periodontitis that makes the diabetes worse, and vice versa. Diabetes, because it comes because you have a lot of sugar maybe in your body,
yes,
it makes the oral disease worse, or it makes you susceptible to oral diseases. So it's a two-way traffic, and people need to learn about this. The same thing with cardiovascular diseases, and the same thing with the rheumatoid arthritis. Both the periodontitis and the rheumatoid arthritis, they are chronic illnesses that cause, and the factors that lead into this, and the bacteria in the mouth makes it worse.
Oh, wow.
Yes, either or.
Yeah.
The rheumatoid arthritis can make the dental diseases worse, or the periodontal disease can make the arthritis worse.
Wow, thank you so much, Dr. Salome, because I like the way you have broken it down, because most of us always sit down and you think to yourself, it's just a small cavity. But I believe even for our audience at home, when you're thinking about that small cavity that you've been ignoring, can be related or can digress your health, your overall health, then you may take a look at it, you may have a different approach to it all. So Dr. Maran, let me ask you something. Based on what Dr. Salome has shared, what are some of the causes of the dental and oral diseases? When we sit down and, okay, so what causes this, what causes that? So that we can now try and start from there, working backwards.
All right, thank you for the question. There are very many factors that cause oral health diseases. I would say lifestyle is one of them. Systemic diseases, like what Dr. Salome has just mentioned, which means chronic illnesses like diabetes, hypertension. We can talk about stress, we can talk about social factors, we can talk about the lack of access, as she said, to dentists generally, because even when you have those issues, where do you go?
Yes.
So when we talk about lifestyle, what are we talking about? We're talking about things like intake of alcohol, smoking of tobacco, shisha, vapes are currently an in thing in Nairobi right now, you know. And then we talk about things like your diet, your sugar intake levels, right? So there are people who consume a lot of sugars, and yet there are basics, there are foundations. Oh, you're meant to be brushing, you're meant to be flossing, using of your mouthwashes, you should do this twice a day. We neglect those, and when we consume all these things, all those lifestyle issues that we are partaking will eventually lead us to having oral diseases.
Yes.
Yes.
Oh, wow. So we are talking about, so now the lifestyle, now we've been able to address the lifestyle. What about what other causes are there for dental and oral diseases?
Right. We can also talk about genetics.
Yes.
There's sometimes when your lineage is prone to periodontitis, which is gum disease, and dental decay, then also you by default are also prone to such like diseases, right? Then we can also talk about stress factors.
Yes.
We can talk about hormones, especially in women. During all these cycles, we have the puberty, we have your menstruation, we have your, pregnancy related. So all these things are all factors that will lead to oral diseases. Yes.
Which even just goes further to reiterate why the mouth is genuinely part of the, of the body. Because, and the more you keep talking about it, I hope, it's having the same impact on you and it's having on you as well at home. And you're starting to look at the mouth differently. I don't know why we never consider, because we are talking, we smile with it, we chew with it. So I don't know why people would not pay as much attention to it, because here we are, you get a migraine for 3 days, you'll rush to hospital. You'll be like, kuna shida hapo. But you'll suffer through a toothache for an entire week. So now let's Dr. Salome, so what are some of the signs and symptoms? I know I've just mentioned a toothache, but what are some of the signs and symptoms, to dental and oral problems, something that definitely warrants a visit?
Okay, thank you for that. One, you don't need to have any symptom for you to visit a dentist.
Okay,
but
let's start from there.
Let's start from there. You do not have to have. You
That's
do
such
not
a
have
Kenyan
to.
mentality.
Yes.
I'm going to the dentist. When you have a toothache?
No.
No, I'm just going.
So we do not have any. You don't need any symptom
Yes.
for you to visit a dentist. You should do that twice a year. Yes. Yeah. But here some of the things to look out for. We start with for the gum disease. In its early stages, you'll have redness. You'll notice that your gums are red, and maybe in some parts or generally they are red. 2, it will be bleeding. So you'll notice you're bleeding, either spontaneous as you eat or when you're brushing. So brushing should not trigger bleeding unless you're using a very hard toothbrush that's causing bruising. So you notice bleeding on soft touch. And then bad breath is also an indication. Notice some discoloration in your teeth. So it could be either yellowing of the teeth, and then it could be either dark stains or brown stains. And then now there's pain, or some black marks on your teeth that were not there.
Yes.
Notice a swelling anywhere in your mouth, and the mouth will start from the lips, inside to the cheeks, to the gums, to the gingiva, to the tongue, and to the palate, and almost near the throat.
Yes.
So anything that looks suspicious, any swelling that was not there, any ulceration that was not there, that is not going away within 2 to 3 days. So those are mainly the things that you look out for. Yeah, those are some of the symptoms that you look out for that should warrant a visit to the dentist the next day.
Aha.
Yes.
And something, like I mentioned, that was completely surprising was to learn that our hormonal changes affect our oral health care. So what are some of the conditions, Dr. Marion, that are unique so that as women, you know, as our daughters, as our mothers, as our aunties, you can be able to tell somebody, you know, this could be related to this?
So for women, we go through, like everybody else, puberty for both men and women.
Yeah.
But for women, after puberty, we have menstruation, as we had mentioned earlier, and then we have pregnancy, we have perimenopausal, menopause, postmenopausal. Like, we are a bundle of hormones.
Yes.
Estrogen and progesterone
It
is
just
just
depends
rocking
on
our
the
world.
day.
Yes. All through our lives, right?
Yes.
So during this period of time when your estrogen, our gums have actually estrogen receptors. And during these times when our estrogen levels are high, we end up having a lot of blood supply to your gums, right? So your gums are very rich with the blood supply, right? So when you have plaque and calculus, even if it is minimal, it causes a lot of inflammation during this period of time. So you'll find you have bleeding gums, swollen gums, you may even have bad breath. Sometimes it goes further to give us dry mouth. So you have a dry mouth syndrome. You feel like you're always thirsty, like your mouth is sandy, sandpaperish, you know, so you always want to take some water.
Yes.
Sometimes when during pregnancy, you find women hypersalivating. It is because of
I
the
know
hormones.
about that one. I know about that one. And you know, that explains it. Sorry to
Yes.
cut you short. For even the women who are watching us, you know, what shall go, and you wonder why a pregnant woman is constantly spitting. Yes, please continue.
So yeah, so you find pregnant women walking around with spit cups, literally, because and it is normal. We want to tell our women it is normal, it is part of life, there's nothing to be ashamed of, and please visit your dentist so that we can educate you further and tell you this is part of the journey. We should take care of our teeth in that during your pregnancy, we should clean your teeth. Do not be afraid to visit your dentist for whatever reason, because your hormones really play a role, and we walk this journey hand in hand with our gynecologist. Sorry.
Yes.
So when you visit the dentist will tell you you're hypersalivating, you have a dry mouth. We can do A, B, C, D about it, right? So mine is just to sensitize women. When your hormones are acting up, please be very aware of your hormonal changes as you go about life, yes? When you have the dry mouth, sometimes you have something called burning mouth syndrome. You eat something that you normally eat, and then all of a sudden you feel like it's like chili in your mouth,
dear.
you know? And that happens a lot during menopause as well, right? So women should be aware that hormones play a role. Other doctors should also reinforce and join dentists to make aware their patients. When you're having these kind of problems, please visit your dentist so that we are able to educate, one, reassure, number two, and three, we are able to give the right management for those conditions. Yes.
Thank you so much, Doctor. I mean, are you guys learning a thing or seven? You know, to this conversation. So you've mentioned something about dry mouth. You've mentioned something about, you know, having too much saliva, and now people are sitting at home wondering, Allah, that could have been it. Dr. Salome, you know, based on some of those symptoms that women experience during their hormonal journeys, you know, with their oral health care, what are some things that we can do to mitigate this?
I think in general, first, for everyone, the things that needs to be done is normalize visiting a dentist. As soon as the first tooth, as soon as the child has the first tooth, start the dental visit so that the dentist can also impart that knowledge in you. Since we are talking about mothers, mothers are the ones who give birth to life. So they are the ones who we need to really also emphasize on and educate about this, so that we can have this knowledge from a young age. Now to these conditions that come about because of hormones, they lead to behavioral changes. So there are some conditions that will get worse because of the hormonal changes, and these hormonal changes will lead to behavioral changes. For example, it's that time just before your menstruation, you're craving sugar. So that is a hormonal leading to a behavioral change. And so you'll tend to rush and pick that very big
1.25 liter of
soda and chocolate. So you're eating the chocolate and downing it down with a soda. So it's us to learn that this is something that we have to live with. every month you experience this, up to even after like menopause,
Yes.
yeah, or during your postmenopausal period. So it's us to learn of the options that we'll have. You do not have to always run to these sodas and these biscuits, cakes, chocolates, but in case, because you're human, that instance that you found yourself indulging in this, you have to ensure you've brushed your teeth.
Okay.
After. Yeah, so because you're trying to reduce the contact of this sugar with your teeth, because that's where problems start. In terms of pregnancy, we have to demystify the myth that when you're pregnant, it's not safe to visit a dentist. It's actually very safe. It is recommended that you should start, if you're planning to become pregnant, you should visit a dentist before. Most of the dental issues are chronic.
Yes.
Chronic meaning they're already existing. Before you even become pregnant, you already have that small cavity, your gums are already acting up. So what the pregnancy will do, it will make it worse. Yeah. So for pregnant women should visit the dentist before, or rather women in the childbearing age should make it their point to visit a dentist if you're planning to conceive.
Yes.
And then if you've already done that and you're pregnant and you're having excessive vomiting, like majority of women have excessive vomiting during their first trimester, which is very detrimental because of that acid. So you'll have the teeth erosion, you'll have so many problems. So for such cases, you can rinse. After that episode, avoid brushing after every episode, but you can rinse. You can do some warm rinses to avert that. And then now you can, in conjunction with your gynecologist, maybe they'll give some medication to reduce the vomiting. And then now there's some bleeding gums, visit your dentist, and then let them have just maybe a checkup and cleaning. There's some swellings that only happen when you're pregnant. So it's good to visit the dentist because they are normal and they'll go down once you deliver.
And what about now? Let's move to menopause.
To menopause,
yes.
Yeah. Now during that period, you see during pregnancy, your hormones are going up. So now this time maybe they might start now going down. When we start also experiencing the dry mouth, the burning mouth syndrome, we'll also need to hydrate and hydrate. We also need to, and some of the way to hydrate, you'll need to take some water. You also need to stimulate more saliva production by chewing, but on sugarless gum.
Sugarless gum?
Yeah.
Yes.
Yes. You chew on the sugarless gum to try and also stimulate saliva production. Because now when you suffer dry mouth, now you also now start getting tooth decay. Because saliva acts as a cleanser. Yes. Yeah.
Wow. Thank you so much. That's a lot of information, and I feel like we need to take a small break so that we can be able to digest all of that. But before we head out, in the spirit of the International Women's Day, how are you, in your practice? You've mentioned that you're the co-founder of Smile At, which is a dental. How are you investing in women to accelerate progress?
Thank you. Firstly, I am very, very proud to run a practice that is female-founded. Number two, by choice, I think by happenstance.
Yeah.
We have a lot of women who are working in the practice. I think part of our marketing team is a female. Our dental assistants are female. Some of the labs we go to have a lot of females in them, and so I think just by design,
yes,
we are empowering our women to practice and work, and we are enjoying this environment because women are very vibrant, honestly. We have a nurturing perspective. We have better listening skills, I must say, We are more attentive, and we're very prone to be very attentive to our clients who come in when they have pain. So in that way, we really try to incorporate a lot of women in our practice and our setup. And also for our clients, we go ahead and, we treat them as women.
Yes.
Our women walk in looking very nice with lipstick such as yourself, and we have to work with materials that require some white input so that we can be able to keep those teeth white, right?
Yeah.
So we have makeup remover in our setup so that we can be able to tell them, okay, kindly clean up. And we even give them a heads up before they walk into the practice. We tell them, okay, we love how you look. We'll give you time after our session so that you're able to reapply your makeup.
To reapply
Yes,
the makeup.
put
Wow.
yourself together.
Yeah.
And walk out the way you walked in. We don't want you to leave ashy. Yeah, so it's those small little things that we are very keen on.
Yeah.
When a woman walks in with her hair, sometimes when you're leaning back, we are keen not to splash water, to protect her hair, to make sure she leaves looking as beautiful as she walked in.
And to leave feeling empowered.
Exactly.
Thank you so much, Dr. Marian. I think that's a fantastic place for us to take a break, and then we'll come back for the question and answer session. Don't go far away. Welcome back to the second part of Dada's show. Remember, our conversation of the day is focusing on female oral health care. We've learned so much, and I hope even you at home have learned so much about some of the special oral needs that women have, especially as we go through the hormonal changes throughout our lives. Remember, if you have any questions, any feedback, any comments about this show or any other that we've had before, feel free to contact us at KBC Channel 1. You can reach me directly at Ashiko, the host, across all social platforms. So now we are getting into the question and answer session, and I'm sure just like you, my audience members have very many questions, and they can't wait to ask our very abled panelists. So to start us off, we have Mr. Kagai. Mr. Kagai, karibu sana.
Hello, my name is Ruben Kagai, and my question is directed to Dr. Salome. So at times when I'm going through episodes of stress, I notice that I develop some painful ulcers in my mouth. So I would wish to know whether it's normal, and in case it's normal, maybe if there are situations when I should be concerned when I notice them in my mouth. Thank you.
Thank you so much. And I know that you're not the only one who goes through that. I know a couple of people who get, certain, if they are stressed out, if there's some hormonal, they get some mouth sores or something of the sort. So please, Dr. Salome, enlighten us.
Okay, thank you for your question. So stress in itself is immunosuppressive. So your body is not at its full, at maximum to fight any infection. So some of the things that manifest, especially due to acute stress, maybe when you're going through something at work, when you're going through before exams for students, you'll tend to notice some sores in the mouth or some ulcer. They look like some small wounds. They might not be bleeding, but they look like, it's just like a small, we call it ulcer, yeah? So when you should be concerned is if even with maybe some over-the-counter ointment or with some normal gargles, it has not subsided or it has not gone away within 2 weeks. Now that one is a point of concern, and you should go see your dentist to rule out now a serious condition. Yes.
Thank you so much. That's completely enlightening. So you're saying, if you've noticed in 2 weeks, it's not gone after you've taken some OTC ointment,
Yes.
then you definitely need to see a doctor. I hope your question has been answered, Kagai. Okay, thank you so much. So our next question is from Irene. Irene, karibu sana.
Okay, so my question is directed to Dr. Salome. There is a lot of burden in regards to brown teeth to many people, especially people who live in Nakuru, Naivasha, or even in Nairobi, people are using borehole water that is regarded as salty water, which is causing them to have brown teeth. So my question is there a remedy for that if someone has brown teeth? And also, is there a way someone can prevent themselves from getting the brown the brown teeth if they live in an area with salty water, and which I think it's regards to fluoride levels. So is it that there's a effect of fluoride if you take fluoride on your body, or is it a certain level? And also there's a heated debate as to whether the amount of fluoride that is supposed to get into your body, for example, are you supposed to use a toothpaste with fluoride? Are you supposed to consume like water with fluoride? Yeah, so my question is regards to that.
That's a good question, and the whole debate on the fluoride, you know, that's wonderful. So people who live in Nakuru, you know, I've been hearing other people are buying water, etc. You know, just please demystify all of that, please.
Okay, so when it comes to fluoride, this one is usually a two-way. We need fluoride for the strength of our teeth, but there's a recommended amount. Yeah? You're supposed to have anything below 1 part per million is what is supposed to be, even in the toothpaste that we use, and even in the water that we consume. So one, if you have fluorosis, we call it fluorosis. If you have fluorosis, is there something that can be done? Yeah, we have treatment that will change. It's not reversible, one. So that's a permanent damage on your teeth. And what you see, like the white covering of the tooth, which is normally affected by the high levels of fluoride, we call it enamel. It does not grow back. Yeah. So once that is destroyed, we have remedies. Yeah. If you are young, like for kids, when you're starting to get your permanent teeth, for example, and you have the brown teeth, you can have some measures taken, not permanent measures, but some measures that will be, maybe some fillings can be done to cover up that, so the effect, that brownness, yeah, will not be as a lot or as seen, yeah, by other people, because you're also looking at the self-esteem of this child. And then as you age, now there's an age that you're no longer developing, you can have other treatment like crowns that now will improve your aesthetics. Because you look at, especially now, there's some jobs, like you can be a news anchor if you have all your teeth brown. You can be an air hostess, you see. So you see, we are also denying these people, and it's a chance, a fair chance to becoming, yeah, to taking up some of those roles.
Yes.
So you find those, especially now the girls, the men, they actually take the back office. So as much as we're also trying to empower them, but we've put them in the back office because you don't want them to be seen. But maybe these are some of the things we've been aspiring to do. So there's something that can be done, not reversing, but there's a treatment on the brown teeth.
Yes.
When it comes to prevention, the amount of toothpaste, most of the fluoridated toothpaste, the amount, I think because it's regulated, is low. And mostly the contact on the teeth is not as long, and you spit like 90 or 95% of that. That one will not lead to fluorosis. What leads to fluorosis is the water we are ingesting. Like a place in Nakuru, they'll use the water to drink, they'll use the water to cook, and they'll use the water to plant the food that they cook. So boiling, fluoride is one molecule that is not denatured by heat. So boiling the water will make the water safe for consumption, so you'll not be sick, but the amount of fluoride is still high. Yeah. So for us to prevent, we need, because that is a large area, maybe the government can intervene to put defluoridation farm before the water reaches the taps, because you are dealing with a mass.
Yes.
But for people, if you're living like in an apartment where there's a borehole water that has not been tested, you can go ahead and take a sample, test it. There's some people who are doing that, and then you can have a defluoridator now yourself. Because even if you buy drinking water, are you also buying the cooking water?
Yeah, you buying cooking water.
And then are you testing the
food?
Are you even testing the drinking water?
Yeah.
To know that actually the level they've written there is actually the right amount. Yeah, so so for prevention, large scale, maybe the government can intervene on that, but at an individual level, you can get your water tested to see how much fluoride you have, because it's supposed to be below 1 part, a certain level, below 1 part per million. And then now you can have, they are experts in that. They'll come install for you a defluoridator, and then now you can, the water will be safe for cooking and for drinking.
Okay.
Yes.
Thank you so much, Dr. Salome. I hope your question was answered, Irene. Yeah, so, you know, I'd like to hear that there's a solution. You know, if you've got discolored teeth and you want to become a flight attendant, or you want to come and sit where she was sitting, there's a solution. So just reach out to our wonderful panel, and of course, you know, reach out to people who will be able to assist. So our next question is from Marion. Marion, karibu sana.
So, hello, my name is Marion Chepngeno, and my question is directed to Dr. Marion. So, there's this theory of breastfeeding children for more than 24 months, or rather breastfeeding the babies when you're trying to put them to sleep, and its relation to having the early childhood tooth decay or tooth caries. So maybe you can expound on that to us so that we can learn more on that. Thank you.
Good question. Demystifying theories. If I sleep with my baby, if I co-sleep with my baby, am I introducing tooth decay?
First of all, kudos to all our women who are able to breastfeed. It is an amazing journey, and it is the best way to pass nutrients to your young one. So breastfeeding at whatever age, we always advocate for it. Even at 24 months, even older, it is okay. Now the thing is, we need to have our basics right when it comes to oral health cleaning, right? So from the point where the child is born, we already start advocating for mothers to clean those gums, right? You wrap a piece of gauze around your clean finger, and then you dip it in some water and you massage the gums of your infant up until the point where they start teething around 6 months, and you continue that process all the way till the point where you're asking about a 24-month-old. A 24-month-old is a 2-year-old. So basically they have around 20 teeth by that point, right? So at that point, your child is talking, the milestones have all been hit. So basically this is a child who is even interested in brushing their own teeth. So at that point, we are not really talking about co-sleeping, right?
Yeah.
By that point, honestly, your child should be away from you in a different room. Now, when you're talking about breastfeeding mothers, that is at the point maybe 6 months all the way to 9 months. That is the stage we are very concerned about when it comes to co-sleeping with your child while breastfeeding. Now, breast milk has a lot of sugar, to be honest, a lot of sugar. So you're doing a disservice to your child when they're sleeping and the breast is still in the mouth and the milk is still flowing, because that milk is literally bathing the tooth. So the bacteria are having a field day. And that is where now caries are, your child is prone to caries, and that is not something you want to expose your child to. So I think this is a habit that mothers must learn. Like when your child is asleep, please do not breastfeed further. You can always withdraw. Number 2, when your child is sleeping, if they're open to it, please massage those gums as I had earlier said with the gauze, right? And then also the last feed doesn't necessarily have to be the milk, right? You can give some water just to cleanse the mouth and make sure your child is okay. And then, of course, it is never too early to visit the dentist.
Yeah, with the gums.
Yes, with the gums. It's a meet and greet. We say hello to your baby, and we introduce you to proper methods of maintaining your child's oral health. I think I've answered your question, Marian.
That's actually really well put, because I think it's just all about the environment of the baby's mouth. You know, you can't be exposing them to certain things and sit back and wonder, oh gosh, how did that happen? You know, so I think that is one myth that has completely been blown. So asante sana, Dr. Marion, to Marion. I didn't even know we had namesakes in the audience. Then our next question is from Miss Rahab. Miss Rahab, karibu sana.
I'm Rahab. My question is directed to Dr. Marion. As you had mentioned earlier that you are a co-founder of Smile Art Dental Clinic. So if I want to book an appointment with your clinic, where can I find you guys and how can I reach you?
Dr. Marion?
All right, thank you for your question. So Smile Art Dental Clinic is in a building called Lumen Square. This is in Parklands, and it is right across MP Shah. So you can find us on the 3rd floor, room 301A. We are also on social media. So we have a website, www.smileart, smileatdental.co.ke. We are on Instagram and on Facebook as smileatdental.ke. And also you can Google. We have a very robust social media team. So once you check out Smile at Dental Kenya, Parklands, we will pop right up.
Okay.
Thank you for your question.
Thank you so much. Rahab, I hope your question was answered. And on to our final question of the day is from Mr. Ted.
Hi, my name is Ted Manywanda, and my question is directed towards Dr. Salome, and it's to do with the braces. So I was wondering, at what age would you recommend someone to get braces? And is there an age where someone can no longer use braces? Yeah.
I like that question a lot. So we are stuck in an age where everybody and their cousin have braces to a point that is it starting to look like, is it treatment or is it a fad? So where are we, Dr. Salome? Please help us, because we are getting bankrupt being forced to put braces on, everyone.
Okay, so maybe to answer your question, maybe I'll do it in two parts. The terms of age, once you start getting your permanent teeth, now when you're up to the age of 6, you have your milk teeth, then you start shedding them, now you start getting the permanent teeth. So you'll have a mixture of that up to until the age of 12, 13. 12 to 14, depending whether you're a girl or a boy. Yeah? During that period, you can start, when it comes to braces, we call it orthodontic treatment. It's not only the braces, what you see, but it's an intervention to create space for all the teeth to fit in the mouth. So you can start as early as maybe 8 years. There's something we call interceptive treatment. So, but that one will have to be evaluated by the dentist. They'll tell you, or they'll decide if they can start treatment at that point, or if they will not, they'll advise you to wait, or you'll have follow-up on the same. But mostly, you start when you have more than 90% of your permanent teeth in the mouth. That is the ages of 12, 13. That's the time now. You'll see most people with now the braces.
All the way till
yeah, teeth are continually moving.
Yes.
So anyone can get braces.
Well, that's a
but
good
yeah,
clarification.
nowadays we have all the options. Maybe Dr. Marion, maybe you can ask or say chat her. Yeah. We have options for our senior citizen. If you're a senior citizen, if you're a member of parliament, if you're a CEO and you don't want to be seen with your daughter or with your son, matching teeth, matching braces. Yeah. They are clear braces, so which you can wear and no one will know apart from the dentist, and they'll help you correct your smile. Maybe the reason is why we are seeing more and more people having the braces. One, we can attribute it to awareness. We are continually creating awareness, and two, socioeconomic status. Nowadays, also people are prioritizing health, because malocclusion or malalignment you see all these diseases we've talked about. Now it also makes you more prone. If your teeth are like this, how will you clean between the teeth? You can't. You see? Yeah. You can't. So you need them well aligned so that you can take care of them. Yeah. So even that parent, you might not maybe be having so much money, but because you've been educated on importance of taking care of the teeth and some of the predisposing factors to some of these oral diseases, one of them being malocclusion, you'll have to save up and take your child to that. So maybe the increase in uptake is also the increase in the awareness of the braces.
And therefore we are saying everybody with their braces. Well, you've made a very good justification. No more bashing people with braces. So I'm going to give an opportunity to Dr. Salome and Dr. Marion to give us very, very briefly their closing remarks before we actually call it a day.
I am glad we had this conversation,
yes,
because now I believe we have been able to reach quite a number of people on the importance of oral health, especially this month being Oral Health Awareness Month, and we celebrated World Oral Health Day, to which we had said, happy mouth, happy body. So I want us to think about our mouth as being part of the system, right? This is where it all starts, where our nutrition starts, our reason for being. We eat, we enjoy food, we laugh, we smile, our self-esteem, everything starts at the mouth.
Yes.
And as such, we must treat it with a bit more respect.
Yeah.
Yes? So let us visit our dentist, let us go over and above so that we are able to maintain our oral health status and hygiene. Yes, thank you.
Thank you so much, Dr. Marion. Happy mouth, happy body. Wow, Dr. Salome?
Yeah, so to echo what Dr. Maran has said, he started by saying that a healthy mouth is a healthy body, and we've actually explained why that phrase. And so for my parting shot, make it a point. If you have not done so, please visit your dentist. And dentists are your friends. Don't be scared. Because it has to start from now. And you see, we are the ones to spread the gospel. We've enlightened you on 1 or 2 things that you didn't know. So it's you to also help us to carry and to disseminate that information to other people. But start with your families. Yeah, start by booking an appointment and visiting a dentist.
Wow.
Yes.
Thank you so much. So we have come to the end of this extremely informative episode of Dada's show. I hope you at home have learned something, 1 thing or 2 things or 100 things like I have, and you definitely will start putting it into practice. So on behalf of the team at KBC, of course, our location partner, Mara Ole Sereni here in Nairobi, and myself, Ashiko Mbune, I look forward to hearing from you on social media. But until then, let's catch each other next time, same place. Bye for now.